And today we're here at Health-Isiolo for a free medical camp together with MPESA Foundation. And the reason we chose this location is because we wanted to get to the vulnerable communities, and Health-Isiolo is one of them. And today we managed to see over 3,000 people, which I believe is a success because they got to receive child services. Lab services where the sugars were checked, to free consultations with doctors, to free medication for whatever that was prescribed. So I believe it is a good thing that we did, and we should have more of these across the country. Therefore, I look forward to doing more of these free medical camps so as to allow the underserved and the vulnerable communities to also get access to healthcare.
It has been a good experience, working in a community level, because we have been interacting with our community people and giving them that service they deserve. As for today, I really want to thank first of all the MPESA Foundation for bringing such a camp. It's very much needed. We have been wanting such thing for our community. One, because you see, our community is one of those communities that don't believe in a hospital. So having such thing to bring them into the community, people have come out in large number for checkups, also for medication and treatment. We were also able to diagnose our people with the chronic conditions that they have and they were not accepting they have. But through this checkup, we were able to diagnose them and give them proper medication for a longer time. As a doctor who have worked in this community for a long time, the common diseases that we usually have is the chronic condition like hypertension, diabetes, and also gastritis. Peptic ulcer disease has been a chronic and common condition, because you see every now and then you can't miss 5 to 6 patients coming with a complaint of those conditions.
This is one of the key activities or key initiatives of the foundations, advancing the health pillar of the Safaricom and MPESA Foundations. So the medical camp is one of the most important activities because we are just reaching out to the community to screen and advance the health pillar. Among that, this is an ASAL area, and we are very keen on the marginalized groups. We are very keen on marginalized areas in this country, and that's why the MPESA and Safaricom Foundations are keen to reach out to the communities that are vulnerable within the ASAL areas to advance the health pillar. Safaricom is also celebrating 24 years in service, and in this we are advancing CSR activities within the counties. We are advancing CSR activities within the ASAL areas, Health-Isiolo being one of them here today. We've seen a turnout of large numbers coming for the medical camp, and we hope that by the end of the activity, so many will have turned out and benefited from this event. During the many camps that I have attended, we realized that in the marginalized areas, we have old-aged persons that need more attention, that need more medical care, and that's why we are in these areas partnering with the county governments, partnering with Lions Care, partnering with Zuri Health to just come together and put up initiatives that will help the community. This is not the final stage, but medical care will continue even after this medical camp. They'll go for further screening to referral medical facilities to be able to get more treatment and attend to their medical needs. As a business is keen to diversity and inclusion of persons with disability, and in the medical camps, that is not exclusive, because we continue to advance and to encourage persons with disability without any segregation. So today I have been able to identify persons with disability whom we have moved from the triage to the screening process, and then this patient was able to get the medical attention needed, where the patient was able to get the medicines required. So persons with disability remains a key focus of the foundations among the vulnerable groups that we are advancing.
It happened yesterday. I got a message on my cell phone that there is MPESA Foundation I have, in conjunction with the county government, are having a free medical clinic here in Isiolo. So in the morning I woke up and happened to arrive here. A very nice occasion. I met with the staff. We went through the whole registration up to the drugs giving. I'm very grateful that I've got all the drugs I needed. With the support of MPESA Foundation staff, we are grateful, and I'm so happy that I've got the drugs and well okay. So I have been suffering from diabetic for the last over 10 years, and I'm happy that I've got the tablets, the treatment for that from MPESA Foundation today. And right now what I have here is the drugs I've been given free of charge. I am so grateful. The population was so high, so many people turned up. I didn't expect to be served so fast like this. But I'm grateful that the staff are well organized, the queues are very short, and I happen to be served very fast. Well, the major problem here is that there are so many people. The healthcare has become so expensive. So many people don't afford. What we are calling SHA and NHIF, so many people don't have, and so many people are hustlers here. They are poor. So when such opportunity comes, they really come in large numbers, and that's why you can see the queue is so long everywhere. My only humble request is that the MPESA Foundation, maybe we like them to be here regularly, help the community. You can see the way the old mothers are lining up in this hot sun. It's good that you have really come forward to help us. We appreciate and we are grateful with your work. I've just been reading on social media and newspapers that the MPESA Foundation is there, but this is the first time I've attended their clinic, and I've never attended before. Neither have I even attended any of their projects. I don't know. But if this is really what they are doing for the community like this, it's a good step forward. That's a good, their goals are okay to the community, especially the poor like this.